Hi, everyone. This is Shane Brady, the Deputy State Epidemiologist at the Arizona Department of Health Services. I'm going to go ahead and get started with our presentation discussing the Arizona COVID-19 response. So we're going to discuss the outbreak to date and the response in Arizona, how you can prepare, and what you can do, and any questions. And we do ask that you write your questions in the chat box, and we will try to address as many questions as we can at the end of the presentation. So I want to start off talking about how this all began. So in December, several facilities reported clusters of patients with pneumonia of an unknown cause that were epidemiologically linked to a seafood and wet animal wholesale market in Wuhan, China. Initial reports suggested animal-to-person spread. And with the growing number of patients without exposure to animal markets, person-to-person spread was suspected. So in January, the cause was identified as a new coronavirus, and by the end of January, there were over 9,000 cases globally. Airport screening was initiated in the U.S., and the first case of novel coronavirus was detected in the U.S. on January 21st in Washington State. On January 26th, the first infection with the virus SARS-CoV-2, which causes the disease COVID-19 in Arizona, was reported in an adult living in Maricopa County with recent travel to Wuhan, China. The Maricopa County Department of Public Health, Arizona Department of Health Services, and the Centers for Disease Control and Prevention coordinated that local response, including case contact identification and testing coordination with CDC. In February, the WHO officially named the new disease COVID-19. And by the end of February, there were 51 countries with cases and over 80,000 cases identified. And the U.S. had their first possible community spread of COVID-19. So as you can see from this map from the WHO, the spread of the virus into a number of countries occurred very quickly, and you can see China as the epicenter. And as of today, the WHO actually declared a pandemic with over 114 countries having identified cases now. So COVID-19, let's talk about the virus. So SARS-CoV-2 is a virus that causes the disease COVID-19. And it's a novel coronaviruses, and coronaviruses are a large virus, large family of viruses. And there are several known coronaviruses that infect people and usually cause only mild respiratory disease, such as the common cold. Coronaviruses can be found in animals, and some of these viruses have the capability of transmitting between animals and human or from person to person. So what do we know about COVID-19? Well, we know there's a wide range of symptoms from mild to severe, and that symptoms can include fever, cough, and difficulty breathing. And of note, this looks very similar to many other viral respiratory illnesses such as influenza. The information so far suggests that most COVID-19 illness is mild. A report from China suggests that serious illness occurs in about 16% of cases. And what we know now is that older people and people with underlying health conditions like heart disease, lung disease, and diabetes are about twice as likely to develop serious outcomes versus otherwise younger, healthier people. The virus is thought to spread person to person via respiratory droplets that are produced when someone infected with the virus coughs or sneezes. And symptoms can appear about 2 to 14 days after being exposed to the virus. There's currently no available medication to treat or vaccine to prevent, although there are scientists working on both. But everyone can take everyday measures right now, including proper hand washing, covering coughs and sneezes, and staying home when we're sick. So we want to talk about the public health strategy when we have these new emerging pathogens. And kind of the initial response, we really focus on containment of virus source. And then as things kind of progress, we move on to community mitigation and preparedness. So we're going to discuss these more in depth. So in the early stages of an outbreak like COVID-19, we're really trying to take measures in public health to contain the disease, stop it from spreading in our communities. So some examples of this locally in Arizona was our local public health partners, our county health departments, we're monitoring individuals who had traveled to affected areas and ensuring those individuals were isolated until a test result came back negative if they became symptomatic, and giving recommendations for social distancing if they were not symptomatic. And as things kind of progress more to this really mitigation phase, and we've seen with the pandemic being declared and with things progressing in the U.S., that really there's a higher likelihood of community spread in the United States, and we know right now in Arizona that there is community spread. So we're really shifting public health measures to really slow the spread of the virus rather than contain it at its source. So as additional community cases are identified, it really may no longer be feasible to isolate infected individuals and quarantine their contacts. And instead, we really might start focusing more on working with our communities and business leaders to really encourage that social distancing. So what can you do before Election Day? So we know this is being done already, but really encouraging people in your jurisdiction to vote early, either by mailing or dropping off their ballot before Election Day, and spreading information on your website and educational materials on the signs and symptoms of COVID-19. And again, if voting early is an option, encouraging people to wash their hands and use sanitizer, and really washing and wiping down their voting stations after use. And again, avoiding unnecessary personnel or individuals at the voting location in the first place. So what can you do to prepare for these upcoming primary elections? So we really want to focus on reviewing our policies and protocols for emergency communication, assessing the essential functions of election operations, preparing for increased absences in employees and or volunteers, and sharing plans with employees and volunteers for infection control procedures. We also want to identify the critical job functions and positions and plan for alternative coverage. Additionally, providing staff training to cross-train those staff to ensure coverage in case people get sick and need to stay home. So what else can you do? So cleaning surfaces and objects that are touched frequently, including desks, doorknobs, railings, computer keyboards, and phones. And if polling centers have touch screens or digital polling, cleaning and disinfecting these surfaces frequently, and consider sanitizing writing utensils in between use. And using bleach and water solution or disinfectants with a label that says EPA approved for killing bacteria and viruses, and always following the directions on those product labels. So what can you do to prepare your staff? So CDC does not recommend that people wear face masks to protect themselves from respiratory diseases, including COVID-19 for the general public. However, we do want to ensure that supplies such as tissues and hand sanitizer are well maintained and placed in multiple locations for ease of access. We really want to educate people about everyday preventative actions such as staying home when sick, covering coughs and sneezes with a tissue or elbow, and really washing hands often with soap and water for at least 20 seconds. And we know that sanitizer might not be available, so we really want to encourage the hand washing because we should have that available in most locations. And again, encouraging staff to get the seasonal influenza vaccine, and placing posters to encourage staff and visitors to really practice respiratory etiquette and hand hygiene in visible areas such as the entrance to your facility or other common areas. So we have some of our resources here posted, and again, these slides in this presentation will be posted on our website or will be sent out to you all. So really, the main resource to go to is our azdhs.gov/coronavirus. The CDC also has information available day to day. And then we have our Arizona Pandemic Influenza Response Plan, which talks about some of our community mitigation strategies. And then there's CDC election polling location guidance. And then we have some preventing the spread in communities and some educational materials as well. So if you have any questions about how to prepare for COVID-19, we're going to, again, do our best to answer questions right now in this webinar and through our website materials, but you can always also reach out to your local health department to get some of those answers if we can't answer them for you. So we'd like to get started with the question and answer session. Again, if you could please type your questions into the box, we'll do our best to reply to all of your questions. So one thing to consider as well, as we know many volunteers might fit into the high-risk group category, just to let you know kind of some of the recommendations that we've been sharing with them as well as CDC. So individuals who are older or have underlying chronic medical conditions, we're really recommending that those individuals kind of stock up on some of their supplies like medications, tissues, and other household items and groceries, and taking everyday precautions such as avoiding people who are sick, washing hands often, cleaning, disinfecting high-touch areas, and staying away from crowds if possible. So those recommendations are going out to those individuals, and if they are volunteers, you might get questions about whether they should go to the polling locations. So we just wanted to share that with you so you know that those are the recommendations coming from us and from CDC. And so we have a question about when COVID-19 is expected to peak in Arizona. Do you have a sense of how long it will last? You know, just like seasonal influenza, it's unpredictable. We don't have an idea of how long this is going to occur. We do know that it does spread via respiratory droplets, similar to flu, but it's unpredictable at this point to say when it will peak.